Welcome to Physician Focus with the Massachusetts Medical Society. I'm Dr. Bruce Carlin. The return of measles, mumps, and other vaccine-preventable diseases, in large part due to unvaccinated individuals, has prompted renewed concern by physicians and public health officials over vaccines and immunization. This edition of our program will examine the causes of the recent outbreaks and what can be done to prevent future ones. We'll look at such questions as, why are patients and their parents avoiding vaccines in the face of scientific evidence of their preventive value? What can physicians do to reinforce the importance of vaccines, called one of the 10 greatest public health achievements of the 20th century? What are the risks of not getting vaccinated? And how might this new anti-vaccine sentiment further affect individual and public health for both children and adults? With me for this discussion are Drs. George Abraham and Dr. Sean Palfrey. Dr. Abraham is board certified in internal medicine and infectious disease, Associate Chief of Medicine at St. Vincent Hospital in Worcester, and a professor of medicine at the University of Massachusetts Medical School. He is also governor of the Massachusetts chapter of the American College of Physicians. Dr. Palfrey is a board-certified pediatrician practicing at Boston Medical Center, a clinical professor of pediatrics and public health at Boston University School of Medicine, and the founder and director of the Immunization Initiative of the Massachusetts chapter of the American Academy of Pediatrics. Welcome to you both.
Thank you.
Thanks, Bruce.
Good to have you here. So in the winter of 2014, we had an unprecedented measles outbreak. How did this get started, and what's going on? What did we do right? What did we do wrong?
Well, a place like Disneyland is filled with all sorts of people, and this country hasn't had measles naturally in it unless the case is introduced. We don't know exactly how this case was introduced, but going into an amusement park like this with thousands and thousands of people, some of those people are going to be at risk for getting this infection. It's a very infectious disease, and so if a case comes in from outside the country, it is quite likely to be picked up by one or more people. And then when they go home, in most places around this country, there are not going to be susceptible populations, but some, there are going to be families or communities where they're not vaccinated and therefore not protected against this illness.
And so what you're saying is if everybody were vaccinated, presumably we wouldn't have a problem. Or what percentage need to be vaccinated to prevent the problem?
Correct. I think what Dr. Palfrey elaborates on is the fact that as more and more people are vaccinated, they in turn build up a barrier which prevents the spread of disease, the concept of herd immunity as we call it, where a sick child is surrounded by healthy children who in turn sort of behave like a sort of invisible barrier to prevent progression of disease. But if there are other children who in turn have not been vaccinated, they are going to get that disease from that unfortunate sick child, and then in turn it keeps spreading. So this is a very concerning fact that people are choosing not to vaccinate their children, which is unfortunate given that vaccines do prevent disease.
The number you're looking for is probably about 90% for this illness. It depends on how contagious an illness is. This happens to be a very contagious one. So if we can attain 90% of the population being vaccinated, it will keep the illness out of that population. Once it drops below 90%, you've got individuals who may be susceptible and get the illness and then spread it further.
It's purely mathematical. In other words, you take the disease susceptibility or the disease virulence and do population studies. 90+%
takes about 90%.
Can give you that protection.
Correct.
So given that, how do we ever get below that 90%? It seems to me that, as we said in the introduction, this is like one of the great achievements of science ever. I mean, immunizations work.
Probably second only to clean water. vaccines are extremely effective. What happens is in most of the country we have more than 90% of the population protected, but in other spots, other communities, you may have a much lower number. They may be as low as 50% in a particular family, group, school, or community which are protected, and therefore the disease can spread.
Well, then line up the risks that you're taking of being vaccinated versus not being vaccinated. What are the risks of being vaccinated?
So it depends on the type of vaccine. There are what are called killed vaccines and there are what are called live vaccines. So killed vaccines mean that there is only the protein of the bacterium or virus, but no real actual part of the bacterium or virus which could in turn induce an actual illness. And so in those vaccines, there are basically no risks whatsoever. They can be given to everyone, including people who we consider vulnerable, such as people with advanced HIV, or people who've had cancer or on chemotherapy, or other diseases which affect their immune system, etc. In live vaccines, the only difference is there are vaccines which have actual live bacteria, but they are killed in a way that they are not able to reproduce or not able to produce actual disease in the person. And so the difference is that in people who have a decreased immunity, so vulnerable populations that we talked about earlier, they could sometimes get actual disease in those situations. And so we try to avoid it in those select populations, but the larger majority, they still can receive the vaccine without any problems whatsoever. So as Dr. Palfrey alluded, and as you alluded eloquently, vaccines are life-saving. They are definitely the most remarkable progress in medicine. And it's a shame that people opt not to receive it. It's purely a matter of choice. It's not that it's not available or it's not offered. People decline to get it for personal reasons, one or the other, which science really doesn't support, and which is what our big message is to say that we need to give people vaccines, not only protect their own children, but surrounding or other children as well. There are ages when children cannot receive all these vaccines, and those unfortunate children are made vulnerable as a result of these vaccines not being given and children being sick.
How did we get as vulnerable a population? How'd that happen at Disney World or Disneyland?
This is not a new phenomenon. When vaccines were first invented, people felt that this was against God's will or it was unnatural in various ways. But as they realized how serious the illnesses were and how fatal they were, that if you had a substance like this could protect the vast majority of people, then an entire population came to accept it. We have, over the last 30, 40, 50 years, kept so many of these vaccine-preventable diseases under control that people do not understand how serious they are. And so they feel that measles or chickenpox or polio or any number of the vaccine-preventable illnesses that we can treat now are not so serious. They're not here. They're not a worry. But they are, in fact, here. And physicians like ourselves, unfortunately, see those cases. Maybe they're 10% of the cases of people who get these illnesses who actually have devastating courses of the illness and may die. And so part of our job is to say to people, the risks of vaccine are almost unimaginably low, much less than being struck by lightning or dying from a dog bite, for instance, and much less certainly from being hurt in a car accident. So that the risks of taking a vaccine are very low, whereas the true risks of getting the illness is serious. There have been people around this country not understanding how serious these natural illnesses are, who say, it's my choice. I don't really care about the population and protecting a population. I'm not going to have my children vaccinated. And so this is how communities build up that say, we don't want to be vaccinated against these illnesses. It is those populations and those families who are at greatest risk, not just for themselves, but for their communities. Because by immunizing one person, we are protecting those around. As you said, the infants or the elders or the people who have low immunity. And so we feel very strongly that we must immunize as many people as we can possibly do medically and scientifically so that we protect everybody else.
So is part of our problem not exposing people to what the actual risks are so that they have no concept of just how serious these diseases are? As you said, well, measles, mumps, when I was a kid, we got them. And nobody thought too much about them, although I'm sure that some of my colleagues from younger days were permanently disabled by it. I certainly have patients now over 70 who are blind or deaf from measles that they had as infants. And
what people don't realize is that around the world there are hundreds of thousands of children who die each year of measles. In this country, because we've vaccinated well, that isn't the case until the disease enters the country in a way such as this.
I think Dr. Palfrey eloquently pointed out that unfortunately this generation has not seen many of these illnesses because they are so young, and their parents probably have seen it. And so because they've not seen it, they've not really seen the gravity of it. The other is, unfortunately, social media has its benefits and has its disadvantages. And people who generally have these strong beliefs against vaccines or maybe some strong feelings for one particular reason or the other why they don't immunize children tend to be very vocal in social media. And unfortunately, that gets picked up. And unfortunately, sometimes the wrong message gets spent around, saying that children are being, quote, poisoned, or things are being introduced into their body which is not natural or unnatural, and things like that, often which is not founded on science or any logic, but just pure feelings and emotion. But if you're more vocal on social media, it just gets picked up and carried around, so people tend to get swayed by that, unlike the science and the reason and the logic, which depends on people thinking rather than on speaking.
So how do we change that equation? How do we as doctors get in there and say, look, how serious are these diseases? Let's just talk about some of the disease-preventable, vaccine-preventable diseases.
If we can get across to people that the illnesses are serious, can cause death, do cause death right now around the world in places that do not have sufficient vaccine penetration into the populations, that's step number one. Step number two is that people don't realize that several of our vaccines prevent cancer. People are very terrified of cancer. That's something much more real than chickenpox or measles or even polio that they may not have seen. We have several vaccines, the hepatitis B vaccine and the human papillomavirus vaccine, that prevent cancer. So we are moving constantly into areas that make a difference to people, that actually shake them. So that's one thing we do. The other thing that I do when I have a parent who says, I'm not sure I want to vaccinate my child, is I turn to them and I say, well, what worries you about it? And I get them to express to me either their lack of concern, their feeling that this is a dangerous vaccine, they're feeling that the illness isn't very serious, they're feeling that it's a conspiracy from the drug companies or the government. What is it that makes them hesitant about it? And then I can address each of these issues with them. If they are not absolutely fixed for some hard to understand reason, I can usually explain to them why we feel the balance is so far in favor of vaccinating their children, that I vaccinate my children, my grandchildren, and all my patients.
In adults, it's slightly different. There are several vaccines, and I think Dr. Palfrey eloquently stated that many of these vaccines, which he alluded to in children, are also applicable to adults as well in terms of preventing cancer, etc. And the concept of the fact that that the only reason that they don't get the vaccine is because they haven't seen the diseases yet, or they feel they are fine, so they don't need it, or that vaccines only apply to children, not needed in adults. So I think, again, the same, the time to take that conversation, to have that vaccines do prevent disease, do prevent serious illnesses like cancer, that just like children, even adults need it. Sometimes childhood vaccines need to be re-given in adult situations so that we continue to boost our immunity or our ability to fight those infections. So I think it's just the time. And yes, we are able to sway a number of folks, and then obviously some folks feel that they're just too healthy and don't need the vaccine, and so there's a small minority we're not able to convince. But
let's just dwell on the cancer prevention.
Okay.
Can you talk to us about what the HPV, human papillomavirus vaccine, is doing and how it works? And
so human papillomavirus is a sexually transmitted disease primarily. And we, as with all of our vaccines, we give the vaccines before a baby or a child or an adult is likely to catch that illness. So human papillomavirus, HPV, is an illness which most teenagers are likely to be exposed to. We know it statistically, almost everybody's going to be exposed to. Some cases will just give you venereal warts. Other cases will go on to cause cervical cancer, which is one of the most important and serious cancers in a woman's life. And so what we've found is that if we can prevent HPV exposure and illness before the child becomes sexually active, we can, especially with this new vaccine that just came out, prevent up to 90% of the cancers, as well as the more nuisance-like acute illness, the warts, the venereal warts.
And the same with hepatitis B.
And
likewise.
hepatitis B, we do the same thing. We actually start that immunization process at birth because we know that infants can get it from their mother. And so we immunize them right at the time of birth. They are more likely, if they do not get it at that point, to get it as teenagers because it too is a sexually transmitted disease. It too causes, in this case, liver cancer. And those cancers appear decades later. But in order to prevent the cancers from ever appearing, we have to immunize the children as babies or as teenagers.
And I think an example is, if anyone is skeptical about that, go to India or Asia or one of those countries and just see the volume of folks who have hepatitis B disease just because they've had mother-to-child transmission, unfortunately, from not having access to vaccines. So vaccines definitely save disease, not only prevent disease, but prevent cancer.
Two other points that I make. One is that most of the illnesses that we are preventing with the vaccines are illnesses we cannot treat. So we must prevent them, because once they are acquired, there is no treatment for it. But by prevention, which is the core principle of pediatrics and of internal medicine, but for us, preventing illness is the core principle. If we can prevent them, then they will never get these illnesses. But if we don't prevent them, they get in and we cannot treat them. The other thing that people have not understood is that an illness such as smallpox, which was a major killer around the world for millennia, thousands of years, by generating herd immunity, by immunizing a sufficient number of people all the way around the world, has been eliminated. That virus no longer exists. It shows the power of creating herd immunity because we can eliminate that disease in its entirety from the face of the earth. And we're trying to do that now with polio and with measles. But as long as people push back against vaccination for one reason or another, we cannot eliminate those diseases from the world.
I think you asked the question, what if we don't vaccinate? What if people get actual disease? And I think the classic is even something as simple as the flu. If they get it, it's not really the influenza, but the complications of it, such as pneumonia and complications of the nervous system, where it can affect the brain, it can cause an inflammation or infection of the brain, nervous tissue, cause paralysis, other serious complications. Those are what are most concerning, and unfortunately people die of those illnesses And so these diseases may appear, one might consider that, oh, it's just a viral disease, just like a flu-like illness. It's simple, it'll last a few days, it'll go away, but unfortunately those complications are very serious.
Well, I think people often say that I had the flu, and when they come into my office, they haven't had the flu. If they had the flu, they wouldn't
be seriously ill.
They'd be much more seriously ill, and I don't think people appreciate the difference between a flu-like illness and the flu.
Yeah.
And I have this fight quite frequently with patients in the office. Says, oh, I had that last year. I don't need it again. I've never had the flu, so I don't need it. And I say, I don't think that offers you protection, not having had it before. But how do we break through some of those arguments?
I think it's the same concept as, take the flu, for example. Our seniors who probably taken flu vaccine year after year tend to remain relatively healthy, while our younger people who probably skip it thinking that they're young, they're healthy, and so they don't get the flu, so to speak, are the ones who end up, unfortunately, very seriously ill and in hospital with pneumonias and other complications, who end up in our ICU or other places. Look at parts of the world. There's a big epidemic right now of H1N1, the swine flu, going on in India, where there is no flu vaccine which is administered to anyone. And so we do have evidence of outbreaks at different parts of the world all the time. So we caution our folks who are traveling to those places for work or for pleasure or for visiting family. We tell them, be careful, because these are all spread. Most of these, unfortunately, are spread through the air, and so we breathe the same air, we're around someone. Unfortunately, this is how the vaccines spread. These diseases spread so rapidly, which is why vaccines are so useful in helping to create that barrier.
Another example is chickenpox. Once we introduced the chickenpox, the varicella vaccine, people said, oh, no, I don't want that. I want to have a chickenpox party and expose all our children to it. What they don't realize is that, sure, 90% of the people who get chickenpox just get an annoying illness that's uncomfortable, keeps them out of school for 10 days and keeps their parents out of work for that period. But we as the physicians see the serious cases. That may be 5 or 10% who get the pneumonia, get the encephalitis, the brain disease, and they really are serious. But we see those, whereas the general population doesn't.
And to pick up on that theme, chickenpox, so if I were to choose between getting the disease and becoming immune to it rather than the vaccine, I would choose the vaccine, because if I get the disease, I know that down the road I could get shingles, which is also the chickenpox virus, which activates in the adult, and I could get shingles and complications of shingles, including the neuralgia, the dreaded pain of shingles, which could last for years and could be bothersome to me, while if I'd gotten the vaccine, I'd be protected. And so there is the same concept. So exactly, there are always downstream implications of what we do.
Now, with a lot of these, there are also some of the things that the protection isn't 100%, and that not everybody can get the vaccines. So with the shingles vaccine, if you're immunocompromised, you shouldn't be doing that.
That is correct.
But that's so few. You need to protect those that are.
You need herd immunity, exactly, so that you can
right.
protect the people who may be protected,
Exactly.
and are protected, so that the illness cannot reach those who are vulnerable. I'd like to go back to one thing that you asked: how do we get this across? I think it's really important for us as physicians to respect the perspective of our patients and their parents. So that's why I say to them, what are they worried about? What are you worried about? How can I get you to the point? How can I explain the balance of risk and benefit? How can I teach you about the illness itself and the vaccines themselves, and get across the fact that these have been studied in millions and millions of patients, both before we introduced the vaccine and then for decades afterward. So we know more about vaccines than we know about any other medications ever, anywhere. And so to be able to say this is safe, we have the scientific data.
The safety is unassailable.
Right.
It's
as best as, as Dr. Palfrey said, probably more studied than most other things, including medications that we take to treat some of the complications of these illnesses. So, definitely.
So, our job is really to say, look, these things are the safest group of medicines that we've got.
I think the CDC, the government has put out, so the CDC has this public information which is available on its website for every disease. It pulls in little information together. It's talked about vaccines. There are in simple lay terms to tell you about risks, complications, how the vaccine has been studied. There's a vaccine adverse event registry system which allows the government to report for people who think, which is investigated in turn to really see if it was a genuine complication or not. So there are lots of different public advisories, newspapers, public settings, and I'm sure other programs such as ours also pick up the same theme, but it's the individual responsibility of each of us as physicians as well to educate our own clientele about the same thing.
And I think, as you said earlier, anecdote is so powerful. My mother said, a star on TV said, this website said that this happens. That was the formation of the superstitions of the old days. There was an eclipse of the moon, people seized, people died, therefore they died because of the eclipse of the moon. And part of our job is to give them examples like that. Seeing a black cat walk across your path does not cause you death or illness. That there are so many examples of irrational belief systems.
Thank you both for a wonderful program. I hope our discussion today has reinforced the value of vaccines, why they are important for both personal and public health, and why both children and adults should stay up to date with immunizations. For more information on vaccine, visit our website at physicianfocus.org. I'm Dr. Bruce Carlin. Thank you for watching.
I'm Dr. Sean Palfrey.
I'm Dr. George Abraham.
The recent outbreak of measles across the country, due in large part to unvaccinated children, should serve as a stark reminder about the benefits of immunization.
Vaccines are powerful medicines with an extraordinary record of safety in preventing disease and death, but too many people forget or ignore their benefits.
The measles outbreak has brought welcome attention to the importance of childhood vaccinations, which can also protect against other dangers such as mumps, tetanus, diphtheria, and pertussis.
Yet adults need immunization as well to protect against conditions like hepatitis, meningitis, and pneumonia. In fact, more than 50,000 adults die each year from diseases that could be prevented by vaccines, and millions more get sick.
Vaccination is one of the safest preventive steps in all of medicine for both your personal health and our public health.
Make vaccines an indispensable part of your health care. For more information, visit the Centers for Disease Control.
I'm Dr. Richard Peters. The abuse of prescription medications has become a serious public health problem, especially among young people. Physicians are careful when prescribing these medicines, but the drugs are often diverted to people who use them without a doctor's prescription. In fact, more than 3 out of 4 people who misuse prescription pain medicines use drugs that are prescribed to someone else. If you take prescription medications, follow these steps to help us reduce the abuse of prescription drugs. Use medicines only as directed by your healthcare provider. Don't share prescriptions or use another person's medication. Keep medications in a secure place where others can't get at them. Don't mix drugs or use them with alcohol. And dispose of unused drugs properly and promptly at your local police department or through drug take-back programs. For more information, visit drugabuse.gov.